Good evening, everyone, and thank you so much for your time and being here with us tonight. My name is Anya Rao, and I'm the Head of Product Partnerships and Innovation at Telstra Health. I've spent 20 years of my career working in healthcare, with the last 4 of those at Telstra Health Medical Director. In this session tonight, we'll be discussing AI in practice and the recent Heidi Health integration now available inside of Medical Director Clinical. So I'm streaming live today on the lands of the Gadigal people, part of the Eora Nation. On behalf of Telstra Health, I would like to acknowledge the traditional custodians of the country throughout Australia and recognise their continuing connection to land, waters and culture. I pay my respect to their elders past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander peoples. Joining me tonight is Dr. Ben Condon, Go-to-Market Clinical Specialist at Heidi Health, Prashiba Thavarajadeva, General Manager, Director and Practice Owner of Mawson Lakes Healthcare Complex, and Yoav Fisher, Account Executive, Heidi Health. Prashiba, you're a practice owner. What brought you into practice ownership, and what does a typical day in the life of a practice owner look like?
So I've been a practice manager, thanks Anya, and welcome to everyone. I've been a practice manager for 15 years and started off, my background's from engineering to finance, etc., and joined the family business to help out my aunt as a GP and got to know the ropes. And so the last 9 years has been of owning practices. We've got 3 practices around Adelaide. And the day in the life of a practice manager slash practice owner, I always consider myself as jack of all trades, master of none. You're always got to look into your literally your little toolkit that you carry around and try and figure out solutions and to problems. And you're always looking for new ideas. That's my day to day as a practice manager slash practice owner. It's a lot about people relationships. That's what I think practice management really is about, and making sure your team and the people that work within your teams and the patients that do come into your practices are the important people.
Yeah, that's really insightful. And so Yoav, I might sort of pass through to you. What's it like working at Heidi Health? What's the day in the life of working at Heidi Health like?
Can you guys hear me?
Yes, we can.
Okay, cool. No, thanks for having me. Firstly, nice to meet you all. Day in the life of Heidi. It is a day feels like 3 days or a week sometimes with so much going on. It's a super exciting environment to be in, and just full of positive energy and really impactful, rewarding work of what the product is doing and achieving for clinicians and organizations around the world. I've definitely never experienced anything in my lifetime like this, and I don't think I ever will.
Yeah, I can only imagine how fast-paced things are and how quickly things are moving in that space, Yoav. And Prashiba, just back to you. How did you introduce the use of AI in your practice?
So it was thanks, Anya. It was I guess for us, it's always the talk of the town these days, how AI could be incorporated into general practice or into healthcare. And so for us, we took the small steps about 6 months ago, discussing it with GPs and thinking about what their thoughts are on AI and bringing that into the practice in some form or fashion. And I guess the easiest option that we were discussing is an AI scribe. And so during the clinical meetings, we were able to, I guess, plant the seed that it will be a tool that is additional to what they're already doing to assist them in their consults. So that's how we sort of started talking about it and having a discussion and an open discussion. And you're always going to get different viewpoints. There are going to be those people that are going to be, in a way, really the early adopters. And then there's always going to be people that maybe a bit more skeptical and take a bit more time to really understand what AI, how it really fits into it, and whether I guess, the privacy, confidentiality, and security kind of concerns.
Yeah.
So it's having that discussion first with your clinical teams.
Yeah. And how has AI been received by the patients in your practice?
So we always talked about the patient journey and how, impactful the patient and the interaction with their primary clinician is. And so for us, it's important to, I guess, for the GPs, they always want to spend more time listening to the patient, looking at the patient, and getting their medical history and their concerns. And so there's always time pressures. And for the patients, and a lot of this is anecdotal, where the patients felt that the doctors were able to listen a bit more, and they understand what, with AI, it helps the doctors write the notes, but also to listen to the patients, and they're not focused on the computer. And traditionally, the GPs tend to be looking at the computer quite a bit, and they're trying to capture as much of the patient information as possible during the consults. So we have had that input where the patients do feel that doctors are actually spending a bit more what we call quality time with that face-to-face interaction.
Yeah, that's really interesting. Yoav, I'm not sure if you have it available, but it would be sort of great to kind of understand, what are the benefits over using an unintegrated or an integrated version of AI? We recently obviously brought Heidi Health into Medical Director Clinical. Be great to get a demo of what that kind of looks like and that end-to-end experience.
Yeah, of course. So I think integrated versus unintegrated, of course, as you can appreciate, it means that everything was in the one screen for you. And it ensures that you don't really need to be using any other browsers or apps or anything like that. It's all in the one screen for you. And that's what it is with Medical Director. You've got Heidi embedded within the software, which means that you can continue to complete your normal everyday work within Medical Director, and then also have Heidi available on the sidebar there in the widget to support you in utilizing Heidi in your consults. So it definitely makes it a lot easier for the clinician. There's no doubt about that. And yeah, it's obviously very preferred. That's for sure.
Yep, that's great. We just had a question posted in the chat, and over to either one of you. Any advice or guidance on how to roll AI out in the practice, and how to seek patient consent and how to inform patients that the practice is using AI? Maybe Prashiba, starting with you.
Yeah, absolutely. I guess to roll it out is, from our point of view, it's always looking for those, I call them change agents, your clinicians that are willing to take that, in a way, leap of faith, or that leap to try something new. And so at each of our clinics, I know the clinicians that are willing to be my guinea pig, so to speak. And they're the ones that I approach and just say, hey, we would like to bring in an AI scribe. For us, it's an ability for you to, I guess, help your patients to better note taking, spend a bit more time. You could catch up on actually your breaks and just have a proper lunch break, for example. So, and potentially see more patients. So, focus on them, and then use those change agents to, at your clinical meetings or your team meetings within your own clinics or within your own teams, have them talk about the different cases where it's helped them improve their own clinical judgment and own clinical outcomes for the patient's benefit. And that's how we're sort of adopted from a patient consent point of view. We always say, always get that consent and document it in the patient notes, that they understand that the consultation is going to be recorded, but it will be securely removed within 7 days. That information, that there is a clear path where the patients can decline to have that AI scribe turned on. So as long as you get the verbal consent documented in the patient notes, and they're able to understand that it's not going to be kept forever, it's a moment in time, that conversation.
Yeah, and that's a really important point. So just on, the part 2 of that question was around data storage and, if it's hacked, who takes on that responsibility? And I guess for that purpose, in the integrated version that we have with Heidi Health, none of the recordings are actually stored. They're all deleted. And after 7 days, anything is actually deleted off Heidi Health servers. And the only source of truth is in the PMS. Whatever the doctor has stored down into the patient consult notes is the only thing that's left. So that risk is really reduced and mitigated. So Ben, what we did do was a bit of an icebreaker. Would love to hear your experiences as an ED physician.
Yeah, of course. So worked in emergency or clinically for about 8 years. Started out actually as a surgical doctor. Loved that, but realised I wasn't very good at the on-call, so I ended up in emergency. Ironically, 2 weeks before the pandemic hit in Melbourne, so that wasn't equally wasn't the break I was after. But I really enjoyed emergency because of the variety. Was able to get the same procedural enjoyment that I did from the surgical work, but got to see a breadth of patients from various walks of life, which I really enjoyed. The day was pretty chaotic. Would constantly be run off our feet, running from cubicle to cubicle, and really anything that kind of helps you get through the work and importantly get the patient where they need to be, and often documentation is the limiting factor to that. So I've always been interested in how do we improve the systems and the ways in which we work to kind of get patients out of the emergency department and where they need to be. My first experience of AI was in a busy emergency department. I had a colleague that kind of insisted I should try Heidi because we were getting absolutely smashed, and it really just kind of blew my mind, and to a point where I was like, I've got to go work for these guys. So now my role is to kind of explain to clinicians exactly what we do, that all of the functionality and features that we have, and hopefully give them confidence to try it and use it in their day-to-day practice and really feel those same benefits that I did.
Yeah, it's interesting. We're just right at the start of the uptake of AI. I think I was reading a statistic that only 30% of clinicians have even tried using AI. So there's still a long way to go in terms of even just trying it. And then we're only at the start of the journey in terms of what AI can actually unlock in this space and how much it can actually help with that cognitive load. I think that's a really good segue actually to Yoav and Ben. I think it'd be great for those that have dialed in to actually see what the integrated version looks like, how they can even just try it within their practice, and how to navigate and start using the functionality.
I think the first port of call is really in terms of how do you first want to engage with Heidi. And I think a really great starting point is actually not doing it in front of a patient, but doing it with a colleague or with yourself, and actually just trying your first session, seeing what that note output looks like. And I think it's a really good, easy way to kind of build your confidence in the tool, but also so you're not kind of exposed like Yoav and I tonight in front of patients and colleagues when you're trying things for the first time and demoing and presenting. So find that's a really helpful tool and way to approach it. And we'll get this demo up and do a very quick mock consultation. And is there anything you wanted to talk about in the meantime, just while we're getting this demo up and running?
Yeah, so I'm just having a look at some of the questions that are coming through the chat. And so one of the questions is around, those recordings. So I mentioned that, the actual recording is deleted.
Yep.
Where is the transcript stored anywhere during those 7 days before they also get deleted?
Yeah, it's a great question. So I think the first port of call is to address is there's actually no audio recording of these consultations. So what Heidi is doing in real time is transcribing and creating a written transcript. And that transcript is stored on our Heidi servers. So the way it kind of gets there is it's de-identified and encrypted and sent. Those servers are all held locally in Australia, and they're used only for Heidi Heidi data. And the only reason we would access that data is to generate a note or a document or a letter that you ask us to within Heidi. So for that 7 days, that data lives there, and it's purely there to help you as a clinician generate the notes and the documents that you need. After 7 days, once it's deleted, it's gone. We don't keep it. We don't sell any parts of that data. We don't train the model using that data. It is there solely for that use as a clinician, and we're really clear on that. The reason we suggest keeping that data for 7 days is because we know that when you're following up or you're catching up on clinical work, sometimes if the data goes too quickly, you lose some of that amazing efficiency unlock. So the reason that 7 days was kind of a healthy landing point, where we thought, after 7 days you've written that letter and you've got everything done that you need to do. So that's where it lives. To be really clear, again, it's not an audio recording. It's just a transcript, and it is de-identified by Heidi. So they're all stored separately within different servers as well. So yeah. Hopefully that gives you all confidence that it's nice and safe, and we've been really deliberate in making sure that we're really clear on what we use the data for and where it lives, to give everyone confidence. But pleasingly, Yoav, I can see your screen's up, so let's get into it. Yoav's got the demo platform access on his end. So I'm going to play the doctor and he's going to be the patient, and then the patient's going to step through a few of the different features for us. So Yoav, do you want to just point out, so here in the Smart Scribe pop-out window, you can see this big Start Transcribe button there. When we click that, Heidi will be starting to transcribe. So when you're ready, Yoav. Awesome. So firstly, we could just see that the microphone is green and it's moving, so it's recording. So Yoav, what's brought you in to see me today?
Hey Ben, thanks so much for seeing me. Yeah, I'm in a bit of trouble with my ankle. I was playing footy last night, and I went up to catch the ball and mark it, and on the way down, I completely twisted my right ankle, and I'm in quite a lot of pain. Okay. No, have you been able to walk on that ankle since you've been in had the injury? Sorry. No, not really. It's been it's a lot of pain to put any pressure on it. Okay, all right. And can you tell me, can you still feel your toes, or are you getting any pain or anything like that in your toes, or is it just in the ankle? No, I can still feel everything, and it's all really on the outside of my right ankle. Yeah, outside of your right ankle. Okay. And have you ever rolled your ankle before or anything like that? No, this is my first time. Okay, you haven't hit your head or anything like that. It is just the ankle that you've injured before we just laser in on that. Yeah, no, yeah. It was just my old ankle. Okay, fantastic. What I might do is, I think it might be easier if I have a look at it. So for those watching, let's just pretend that I'm sitting in a consult examining Yoav. And what I'm going to do is I'm going to just verbalize what I can see so that Heidi can pick up on that. I often say, imagine you've got a medical student or a junior doctor in the room with you, and you want to try and explain your thinking. So looking at Yoav, he looks really well. I've just put an OBS machine on him. His respiratory rate's 18. His SATs are 99% on room air. His heart rate's 110, but he looks like he's in a bit of pain, and his blood pressure's 110 on 80. His temperature's 36.6. I'm looking at his right ankle now. It is markedly swollen along the lateral malleolus. Just having a feel there. Yoav, does that hurt where I press there? A lot. Very. A lot. So base of the fifth metatarsal, there's really tender, as well as just around the bottom and the posterior aspect of that lateral malleolus. Doesn't appear to be painful at all on the medial aspect, which is reassuring. And I'm just looking at his toes now. They're nice and warm. He has good capillary refill, less than 2 seconds. Can you feel me touching there, Yoav? Yeah. Yeah, and just under your foot there, can you feel me touching your sole? Yeah. Yeah, perfect. And I'm just going to give the syndesmosis a squeeze. That wasn't too painful, which was really reassuring. And I'm just going to quickly have a look at the knee, move that around. That looks really good. I've seen you kind of hop into my room, not using crutches, but I'm not game to ask you to walk, given how tender this is. So what I think we'll do is, given I don't have X-ray vision, I'll get you an X-ray. We'll get you some pain relief. What have you been taking by ways of pain relief for the last day or so? Panadol and Nurofen.
Fantastic, gold star. So we're going to keep you doing that. I might write you a script for just a little bit of endo and just to get you through the next couple of days. We're going to put some tubie grip on there, get you to elevate that ankle. We're going to get you a pair of crutches so you don't fall over and hurt your other ankle hopping around. And we might even write you a referral to a physio as well, just so that if the x-rays are all clear, you can go straight and see them rather than come back and see me. So do you have any questions, or does that make sense?
That sounds good. That sounds good. Thanks very much for your help, Ben.
Fantastic. All right. Well, we'll stop transcribing at this point. And we're going to select the general practitioner note template, which is the kind of standard GP note that Heidi will offer. I'm just going to give it a second to generate that note. And what we're hoping to demonstrate with this one is one, what the note will look like and how to edit that output, and then how to send it back to the record, as well as also create some other documentation. So here you've seen Heidi kind of populate that note, and there's that, it's got the kind of SOAP layout that is kind of a default template. And this is your opportunity where you can review that note, make sure that it's captured all those details correctly. Really important to kind of make sure that those examination findings are accurate. But you'll see that it's captured where the tenderness was really accurately there around the lateral malleolus and base of the fifth there, which is great. Yoav, if you can just scroll down a little bit, just so I can a bit further as well. You can see that the assessment plan there is pretty accurate. I'm pretty happy with that, and the treatment in terms of the plan moving forward is exactly what I wanted. So from here, let's maybe demonstrate how we can get Heidi to generate a referral letter, or we'll write a referral to the physio. Yoav, do you mind using Ask Heidi just to write a referral letter for us? So if you think of Ask Heidi, this Ask Heidi bar is like our Siri bar almost. If you don't have a template at the ready, or you kind of wanting to create a patient explainer or something like that, you can ask Heidi to do that, and the AI will generate a letter based off that note and that transcript. Importantly, if you edit and make changes to that note, that will also make, and then those changes will be carried through to this letter. So here we have a default letter through to the physiotherapist there that explains the plan and everything like that. Now, my eyesight's pretty, I'm going to rely on you a little bit there, Yoav, because my eyes are straining, but that all looks pretty good from what I can see. So what we'll then do is, are you able to show how you would push the note and this letter back into MedicalDirector?
Yeah, of course. So when you go back onto the note, you'll see there's a button on the bottom right-hand side that says Push Note. Once, of course, you've reviewed that, you're happy with everything, you click on that, and then as you can see here, it'll get sent over to your progress note section for that visit. And you can see as well that there was a little disclaimer there as well to support that this was generated by Heidi. Of course, you would have reviewed everything there. When it comes to documents as well, you'll easily be able to just copy this and place it into the document generator within MedicalDirector.
That will mean that your templates and all of your letterheads and stuff are intact with that one-click copy and paste as well. I think it'd be great, Yoav, if you could just talk us through the template library and community, because I think this is a feature that's going to help people understand how you can personalize these template outputs. We understand that everyone writes things a little bit differently. So if we talk to the community first, I'll let you explain it, and then we'll go from there.
For sure. So the template community is an area where a lot of our clinicians that are using Heidi have voluntarily decided to share their templates that they're benefiting from every day in their practice, that we've internally reviewed before publishing onto the community. And so when you go into the template community, you'll see all of these different types of templates, and you can see exactly what other clinicians are completing and generating within Heidi. So for example, this is what the example note looks like. And if you like it, fantastic. You can see what the template structure looks like on the back end. And just for some clarity on how the template function works, this is how Heidi generates the output that you're after. And this is where I guess the real uniqueness of the product stands out, is how customizable the template function is to suit exactly your need and what you would normally document for your notes, for your letters, for anything that needs to be generated through Heidi. So you can see here that we've got our square brackets which we call our placeholders, and that is the information that Heidi is grabbing from the transcript from the conversation and putting into that specific placeholder. You then have also the ability to include instructions, which are in round brackets. Now, as you can see here, if I scroll down a little bit, you can see we've put an instruction here that says only include if applicable and use as many bullet points as needed to capture the examination findings. So you have the ability to really guide Heidi and prompt Heidi into exactly how you want that output to look, whether it's dot points, full sentences, use patient quotes, use the first name of the patient in every sentence of your letter, whatever it might be. You can get as specific as possible to ensure that each time you generate that output, Heidi is listening to you and generating as to how you normally would generate it. And so you've got your placeholder, which is what information, and then you've got your instruction, which is how you'd like it. And then anything outside of that is your verbatim, for example, the headings that you might have, or in a letter, you might have thank you for referring and then patient name. So that's, I guess, a very high level overview of how the template function works. And as recommended, would highly recommend going on to the template community to see what others are using and how you can benefit straight away. Because if you do like it, you can simply click on add to my library and that'll get into your template library and you can use it immediately.
And there's a template building guide as well if you want to build your own from scratch, or maybe using Ask Heidi. But a really common thing that we see a lot of users doing is going through the community and picking the best bits of each template that they like and pulling that together into a template that they're really happy with. So that's templates. That's the one of the huge unlocks that we have. The other feature I just want to quickly flag before we kind of take some more questions is the context tab. So in terms of a consultation, we know that you know your patients before they walk into your room and you've seen them before. You've got all of this incredible kind of context and background information on these patients before they come in. So if you have to verbalize all of that relevant history again during a consultation for Heidi to kind of understand and get caught up to date, that's going to take a lot of time and it's going to ruin a lot of the magic of that Heidi experience. So the context tab is where you're able to upload referral letters, discharge summaries, maybe a recent, the most recent note from your most recent session with the patient. You can upload up to 100 documents into that context tab. And Heidi is then able to draw from that information as well as the transcript to generate a note. So, for instance, if this patient I'd seen before was a bit older on, say, a blood thinning medication, had AF and a few other comorbidities, I wouldn't necessarily have to verbalize all of that. Heidi would be able to pull that into the letter and the referrals without me needing to verbalize that. So, if you think of context as a way to kind of catch Heidi up to speed, and so Heidi can see everything about the patient that you might have read beforehand or afterwards. And we think it's a really powerful tool to kind of, again, elevate the level of detail and nuance in your note that's specific to those patients. And we're really excited for you all to try it and see how that goes. The other cool feature about context is, if you're like me in an emergency sometimes and you've got a list of patients and you can't quite remember who's who, or in a busy surgical outpatients clinic and everyone's got the same presenting complaint, you can upload a referral letter and the results into Ask Heidi. You can actually ask Heidi to give you a summary of the patient's presentation and why they're in clinic. So I've got a lot of friends that use the context tab as a way to prepare for surgical lists or MDMs, and they get a nice paragraph summary from Heidi, kind of detailing the salient points of the patient's presentation and what they need to follow up and things like that. So it is also a little bit of a scratch pad for you to just prepare for sessions or for lists as well. But yeah, hopefully you'll really enjoy and you can kind of shape to meet your personal workflow. I think we might leave it there for just kind of the structured demo and maybe open up to questions, Anya, unless you wanted me to kind of touch on a specific element that we haven't covered so far.
No, I think that was a great demo. Thank you so much. There are a couple of questions that have come into the chat, so I might just quickly go through those.
Yeah, of course.
What quality microphone is required to capture, patients, especially those that are quite elderly and have a soft voice?
Yep.
Do you have any recommendations? Great
question. So any omnidirectional desktop microphone from Amazon doesn't have to be an expensive one, will work really well. We've got we can I think we have a list of ones that we can suggest, but the key one is an omnidirectional microphone. We've also got an iOS app that will record really well, even when there's no Wi-Fi or limited connectivity, and then that will sync into your Smart Scribe as well. So if you're on the go or just wanting to experiment potentially before you invest in a microphone, your iOS app or your Android app will be able to support very, very well. I use it in a busy emergency department with screaming patients in the cubicle next door, and it's still able to perform that function. So generally speaking, the phone is a really good starting point just to experiment before you make that microphone investment.
Yeah, can I add to that as well for Ben?
Please,
So within our clinics, as Ben said, omnidirectional is probably what we found is the best option, and an omnidirectional one is similar to this. I think you could see that. You get them for, I think, as $50 to $100 on Amazon, and they work well. So then the ability for the GP to move it on their desk, either closer to the patient, and then move it away, and it gives a good, clear clarity of the conversation as well, and it picks up quite well. So that would be my suggestion. It's not an expensive investment.
Yeah. The other thing I would say in terms of patients from diverse backgrounds, maybe English is a second language, Heidi's supported by Gemini's language suite, so over 37 different languages, and has all of the capability to detect accents and things like that. So we've even had a lot of users report that they've struggled to understand the patient, but somehow Heidi's managed to do so in difficult circumstances. So if you've got patients of all sorts of backgrounds, Heidi will still work really well regardless of the language that they speak or the accents that they have as well.
And Ben, another question just in the chat is around, who can use Heidi? Is it just restricted to clinicians, GPs, or can practice nurses use it as well?
Yeah, so practice nurses can absolutely use Heidi as well as any other clinician. Where the way we kind of frame it is we're specialty agnostic, so we'll work for every clinician in any kind of clinical setting. And if you've got, and we've got special seats available for allied staff members within clinics as well that are offered at a discounted rate compared to the doctors. But all of your nursing staff, if you've got a physio in your clinic, diabetes educator, dietitians, they're all able to use Heidi. And the beauty of the templates is that they're able to craft their note to reflect kind of what's appropriate for their particular use cases. And Ask Heidi can generate meal plans. It can generate all sorts of suggestions and things like that as well. So you're not limited to just the doctors in your practice. Every clinician can use it, and certainly on the Together tier as well, all of your admin staff can be on there as well and help generate notes and help you with your workflow without necessarily having access to the transcript and the core note itself.
Yeah, that's great. And Prashiba, do other clinicians in your practice use it as well, or is it just your GPs at the moment?
At the moment, only our GPs are using it. For us, it's getting the GPs comfortable first, and then I guess the nurses have asked for it. But from I guess it's a individual practice point of view. For us, the GPs get to try it out first. They're able to test it out, and once they're comfortable, they tell me, the nurses could use it, or even our allied health as well that work within your clinics as well, that log on to your clinical software as well. So it's, I guess, a stage process, and as Ben said, any clinician can use it. So nurses will be using it.
Yeah. And Yoav, we've had a question on, how can those who've dialed in book a deeper dive with Heidi, especially around CDMs and GP MPs?
Yeah, for sure. So we've got firstly heaps of resources online that guide you through every step of the way of how to best utilize the product, from starting a transcribing session to generating obviously a note template, customizing your template, generating documents, understanding all the features of Ask Heidi, and all of the amazing capabilities of the product. We have heaps of resources online, which also include videos and FAQs and things like that, which I'd highly recommend walking through and understanding. And then, of course, obviously our team's available as well. So if you have any questions, there's the support team that you can access, but also our if it's looking further in regards to maybe an organisation subscription or anything like that, you can contact us through our website as well. We've got contact form that'll go directly to us, and we can then reach out to you and organise a time to catch up.
Yeah, no, that's great. Someone's got in there that Heidi is such a good name. Is there any background or reason and how it came to be?
So I've heard a rumor about this, but I'm not sure whether it's official. So take this with a grain of salt. But I was told a couple of weeks ago that it had something to do with health AI, and they kind of played around with that and ended up with Heidi at some point. But I can't necessarily confirm that with 100% accuracy. But we like that we like the fact that it's human, and giving it a name we thought felt natural for kind of the interaction in the space. So yeah.
That's nice. And can Heidi be used for telehealth consultations?
Yeah, absolutely. It can. So Heidi can be used in telehealth in any setting. So the key thing that you want to check is that when you're in Smart Scribe, that your mic setting for your video call is set to the same microphone as the Heidi transcript, and that will be absolutely no problem at all. But very effective over telehealth as well.
Great.
I think there was a question around remote desktop access and Citrix environments. I think if I could answer that one. So most of our doctors have access to remote connections, and so for them, ability to work from home 1 day a week is an option within our clinics. So then it gives them the opportunity to use Heidi in a offsite environment as well. So, and from our point of view, it works in that regard. As long as your settings are correct on your computer, you could work it. If not, talk to your IT.
It is possible. That is the point.
That's really good to know. We've also got questions around, do observations get imported into the toolbox? And with that context feature that you showed, does the context need to be uploaded every single time you want to use, upload those documents every single time when you've got that patient? And I guess that's part of our evolving integration partnership. So, in future versions of MedicalDirector Clinical, we're actually building out the APIs for Heidi Health to be able to connect into and get that information that you want the AI to have access to, so that it can craft the, referral templates and information that's needed. And in terms of pushing the OBS back, you will also be able to do that as well. So you'll need to obviously review the information, and then it can push it back into those specific areas within the patient's file too. So that's coming in future releases, and that's something that we're working towards. And in terms of, I guess, the future of AI, what is on Heidi Health's roadmap?
Yeah, we're really excited about exploring calls, and we've got calls currently in alpha. So we're working with some select partner clinics where we've given Heidi a voice, and we're actually using Heidi to help doctors follow up on their patients. So great example would be you've just added in a new blood pressure medication for a patient. You want to check that it's actually doing what you want it to do. So you might get Heidi to call that patient 3 days, 5 days, and 7 days post. And then Heidi will flag if it's having the desired effect or not. And then you might be able to then set a parameter. If there's no change, you want them to come back and see you for an appointment sooner rather than later. Or you might say, oh, everything's going well, stay away. And really, we're excited about how we can further enhance and give clinicians visibility on their patients beyond when they're in the room with them, and we're really excited about that. We've also launched tasks into beta yesterday, which is essentially a to-do list, and Heidi will recognize during a consultation with a patient all the little jobs you have to do, be that write a script, write an x-ray, write a referral, things like that, and it will create a tasks list for you to come back to. Say, for instance, if you just want to crack on and see the next patient, you'll have a list there. So Heidi will hopefully also be a task organizer and kind of diary for you to keep you on track. Beyond that, we're very much exploring whether it be clinical decision support or other exciting features that we know have been hotly requested, even maybe with integrations, pre-filling scripts or things like, or filling radiology request forms based on the transcript. They're all certainly within scope, but there's layers of regulation with those kind of decision support tools that we need to navigate, and we're kind of intentionally just approaching those with caution, I guess, would be the way I would frame it. But certainly there'll be lots to innovate, innovations coming out, and we're really excited about the next kind of 6 to 12 months and what that will look like.
That's great. And Prashiba, based on the GPs that are using Heidi at the moment, what are you seeing in terms of productivity and efficiency?
Good question. So one of the things that we discussed is about GPs being able to, I guess, assist in their actual day-to-day clinical work. And so one of the things, a few of the GPs and more complaints as a practice manager, we're running behind time, we need catch-up slots, can't squeeze in these last-minute patients. And so what we're finding is that with the introduction of AI or Heidi AI, those doctors were able to catch up on their notes, and they're not spending their lunch times writing away the notes at the end of the day. So there's a couple of doctors, I'll use the example, that they were always working well into their lunch break. And they always complain, Prashiba, I didn't have time for my lunch. I didn't have time to go to the bathroom, have a break. I didn't have time to do this. And then I had to see another patient and call back a patient and follow up with a specialist. So you always get those kind of queries. And so what we said is, try this note-taking tool. Heidi's there to assist you. It's not there to take over the consultation. It's an additional tool. And what we're seeing is over a 1 to 2 month period, that GP was able to, 1, see an extra patient, 2, have a lunch break, 3, also get out on time. So there's those additional efficiency benefits, but also productivity. They're not feeling stressed that they're going to go over time. And for them, it's the ability to get on with seeing the patient and looking after the patient more than spending the time typing away. And some GPs I know use one finger at a time, which is always a slow process and painful for me to look at. But it happens. So it does assist the clinician. It's not there to take over the full consultation. It's there as a tool.
Yeah, that's really good to know. And Ben, you sort of touched on this earlier on, but just to sort of go back to it again, not all AI systems are obviously regulated equally. Mm-hmm. What steps does Heidi Health take in maintaining that patient confidentiality and the data security?
Yeah, so first and foremost, we've got a really good relationship with the regulators, so with the TGA and AHPRA and even the RACGP and other colleges. So we've been pretty proactive in showing them what we're doing and making sure that they are aligned with what we're doing being safe and appropriate. So we've got all of the accreditations that you need, the ISO 27001 and the HIPAA compliance, GDPR, the kind of all of the independently verified, security and safety standards that have 6 or 12 monthly audits associated with that kind of verify we're doing the right things on an ongoing basis. And then really it's about just making sure that we're going above and beyond to make sure that we're handling this data with care and with, making sure that it's secure at every step of the pathway. So very similar to what I mentioned before, it's de-identified encrypted data on the platform, when it's transferred to the servers, and it's also when it's on the server, and those servers are held privately just for Heidi's use. They're held locally. There's lots of rumors around that we send data offshore. That's absolutely not the case, and we only ever use the data to generate that note. So we've got a whole team of incredible people, clinicians and engineers that train the model separately, and we do that really intentionally to give our users confidence that the only thing we're doing with their data is helping them with their notes and doing what they're asking us to do. So a good example for that is if you contact support and you need to troubleshoot, something's gone wrong, or you can't quite figure out what's going wrong in your settings, you'll be requested to send through a session ID, which is a 24 to 30 character PIN that will allow that singular engineer to unlock that one consultation to look and see what's happening in the back end. That's audited, that's trackable, and that we track that as part of our external compliance thing. So there are only a few people in the organization that have the ability to use that key, so to speak, but we're very clear that we're only using it for specific purposes in helping you troubleshoot or offering support where we can. So you'll know exactly what we're doing and when we're doing it if we ever need to access your data, because you'll be the ones asking us to do so for help. So hopefully that gives everyone a lot of confidence, and we really do try and make it pretty simple to understand what we're doing, but also make it really clear that we take it really seriously.
That's great. I am conscious of the time, and I'm also very grateful and appreciative of our panelists here tonight. Your insights have just been so incredible, and I think seeing that demo in action and seeing all of the benefit that we can now generate for our GPs has been great. So thank you so much. There are a number of questions that are in the chat. So what we'll do is we'll take them offline and we'll respond to all of those questions. Just before we wind up, were there any other thoughts that anyone online wanted to share? Ben, Prashiba and Yoav?
I just wanted to thank you for the opportunity to talk. It's so exciting to kind of get the opportunity to talk to your users, and apologies again for the technological difficulties to start with, but I'm glad we got there in the end.
Fantastic.
And from our point of view, like I reiterate and summarize, for us, it's making our GPs' lives easier and making sure we give them all the tools they need to do their job. And that's all I'm trying to do with Heidi AI and Medical Director.
That's such a nice way to wrap up. Thank you so much, everyone. Really appreciate your insights today, and hope everyone that's joined us has a very good evening.